I'm with Dr. Avinash Katara, a laparoscopic general surgeon. Thank you so much, Doctor, for your time and this introduction.
Thank you, Namita. Thank you for having me.
Thank you, Doctor. I'm Namita Jain, a wellness professional and a wellness author. Doctor, I wanted to ask you, the topic is piles. A lot of people have piles and they just don't know what to do. So what is the reason that a person has piles and what should they do?
So piles is blood vessels in the back passage that come out when you're pushing hard to pass stools. Some of them don't pain, they just bleed. But when they get advanced, when they get complicated, yes, they can be very, very painful and agonizing.
Yes.
Most people associate piles with a photo of a cactus coming out of a commode.
Right.
And that's something that can really be bothersome.
Doctor, sometimes they say that having food which is spicy or chilies, does that aggravate piles or that's a myth?
So anything that causes constipation is one of the main aggravating factors for piles or hemorrhoids.
Okay.
Having less water, having less fiber is definitely a no-no because that gives you constipation.
Right.
It makes you push hard.
Right.
And then you have these vessels pushing out and
right.
causing you that pain. But more than just food habits,
yes.
it's also your bowel habits, your potty training, which can actually give you piles.
Right.
We see a lot of youngsters today in the days of mobile phones and laptops, and they are in the toilet with their gadgets, sitting there for half an hour, 1 hour. It gives them privacy, it is their space.
Right.
But what they don't realize is, yes, they go in with the intention of finishing their emails or all their WhatsApps before they leave the loop.
Right.
But when you're sitting on that throne for about half an hour, 45 minutes, and pushing hard subconsciously, where actually you need 3 to 5 minutes to do the job.
Right, right.
And that pushing out
so the
causes
strain,
piles.
the
strain is one big factor.
Yeah, that.
Also, bad food habits, bad sleeping habits.
Yes.
Sleeping late one day, getting up late, then sleeping early, getting up early. The body is totally confused. The body doesn't know when to sleep, when to get up, when to go to the toilet.
Right.
And then you just look at the watch and you go when it's not actually time, as per your clock.
Right.
And then you're pushing, you're forcing, and all that will cause these symptoms to get worse.
Right. So doctor, someone who has piles, I mean, do they correct their lifestyle habits or do they go in for surgery or, a combination of both?
So not every pile would require surgery.
Okay.
You have the linear versions or the milder versions where you can get away with medicines, ointments, sometimes lifestyle changes alone. You have some office procedures which are not too invasive, which can also give you relief. But the moment it is advanced, yes, you're looking at surgery.
Right.
Fortunately, we have a lot of new minimally invasive techniques now available to us, lasers, etc. Wherein the hospital stays a lot shorter, recovery is a lot more friendly. Patients get back to work in a day or two, and it's no more associated with the sort of painful recovery days you had with conventional procedures.
Thank you so much. I think this is so useful for someone who has piles because there are so many myths floating around, and getting this information from you is really useful. Is there any takeaway message you would like to give to the viewers before we sign off this reel?
As far as piles is concerned, prevention is better than cure.
Okay.
Eat healthy, sleep healthy, have good body habits, and you should be fine.
Thank you so much, Dr. Avinash, for your time and this introduction.
Thank you.